Cervical cancer is the most common cancer among women in Uganda. According to the World Health Organization, this type of cancer accounts for 24.2% of the 9,000 cancer deaths in women in Uganda. These worrying statistics are part of the basis Dr. Amos Mwaka, a clinical oncologist and lecturer at the Makerere University School of Health Sciences, commissioned a research on the stages of diagnosis and treatment of cervical cancer. He conducted the study in Gulu district, northern Uganda.
Cervical cancer is caused by a virus called human papillomavirus. We usually abbreviate it to HPV. Now, this virus is sexually transmitted. And we do know that the prevalence of HIV/AIDS, which is also a sexually transmitted disease in Uganda, is really highest in northern Uganda. We also thought that in Gulu, where HIV prevalence is very high compared to other parts of Uganda, there could be a very high incidence and prevalence of cervical cancer as well.
In the communities, the study sampled over 400 people, both men and women, to find out what they knew about cervical cancer.
The community believes cervical cancer is caused by a number of culturally related things. For example, if the mother, the grandmother tells a young lady, please don't go with this man, please don't get married in such and such a family, and the girl chooses to behave otherwise, contrary to what the elders have advised, this lady is likely to get cervical cancer.
Cultural barriers in remote areas have also prevented women from seeking early medical treatment when they get cervical cancer.
And they indeed told us that there are particular traditional healers who are specialists in treating these diseases, including cervical cancer and many other cancers. And so what happens if a woman gets bleeding from her private part, they will think this may be STD, a sexually transmitted infection. But if they use the medicine for sexually transmitted infection and it doesn't cure, they now think this is cancer. And then they go to these traditional healers who treat cancer. And they perhaps take quite a little while there before they now move on to the next. Indeed, they told us they will go to the hospital only if this treatment has failed.
The study also separately sampled 149 women who had been diagnosed with cervical cancer and were receiving treatment at hospital.
Of the 149, 45% were in stage 3, which is now a late stage of the disease, and 21% were in stage 4. Now, I am emphasizing these two stages because treatment of these two stages is now for palliation, is for controlling the disease. You cannot cure that disease when they're already in that stage.
Christine Chaligonza, a mother of 7, hails from Hoima. She was recently diagnosed with cervical cancer after ignorantly treating bouts of its symptoms.
Vitamin B complex,
Majority of the women in late stage had been to the Health Center 3, Health Center 4 several times, about 5 times or more, before they were referred to the hospital. Now this means, in a nutshell, that the ability and probably the facilities in these healthcare Health Center 3 and Health Center 4 are not good enough.
Unlike most women who this research found to have been diagnosed with advanced cervical cancer, Chaligonza's was detected at the first stage.
Up to stage 2A, that is, the cancer is still just within the cervix. It is still safe.
Like the study found that many women opt for traditional medicines first when they see the symptoms, Chaligonza too admits trying herbs to cure cervical cancer. The narrative that this research puts across requires to be taken to the grassroots to raise awareness of the threat of cervical cancer,
the symptoms of cervical cancer, and the fact that cervical cancer, actually when diagnosed early, can be cured.
Dr. Mwaka advises women to screen regularly to fight the ravaging disease.
Women who have HIV infection need to do these tests every year. Women who are HIV negative, the recommendation is they should go and have the pap smear test, the screening after every 3 years.
The human papilloma virus, which is associated with cancer of the cervix, we can vaccinate against it. And we are targeting girls who are aged 10 years. This vaccination can be accessed in all the health facilities.
So who is at risk of cervical cancer? Every woman who has a cervix is at risk, but women who are HIV positive, women with multiple sex partners, those who have delivered many children, girls who engage in early sex, among others, stand a greater risk. Dr. Mwaka's study put down some recommendations.
There is need for improving the diagnostic ability of the lower level healthcare professionals at Health Center 3, at Health Center 4, and perhaps the district hospitals, so that they can be able to suspect early and refer patients who have cervical cancer.
Gertrude Tumusime with Kware, NTV.